Hello, Dr. Diaz, and my fellow students. My name is Colette Mahakamno. Um, my class is LDR 620. I am here today to talk about strategic plan presentation. I am going to be talking about managing asthma in the schools. Now, we have school health services we provide to the schools, and we do asthma care, acute and emergency care, chronic disease management, of which asthma is one. We care for the family to be engaged in the management of their children, and then we do care coordination. Now, I work for the New York City Department of Health in the Office of School Health. The organization is not a revenue generating organization, but rather a health oriented institution that caters to the health of all New Yorkers, especially the school children of New York. Now, what is our vision and mission? To foster the academic potential of children in the schools by improving their health, to ensure that all school children have access to and receive medical care that can occur in the school, and then we advocate for the health and well-being of all the children in the school system. Now, managing asthma in the schools, this is what we do. Asthma is a chronic condition, and we don't aim to cure asthma, rather to control asthma and help the students remain in the school. That is why in the schools, the nurse who is in charge of the medical room teaches the students what asthma is, the presenting signs and symptoms, and the triggers. People's triggers are different from each other. So the nurse helps the students to understand asthma and then know how to control their asthma. That's why the nurse teaches a 45-minute asthma class once a week for 6 weeks to students who have asthma, so that they can be in a better position to manage their asthma. Now, what are the strategic goals we want to achieve? One of them is that since asthma is a chronic condition, we don't aim to cure asthma, but to control asthma. And as such, we want to make sure that we improve the management of asthma in our schools, so that asthma will be under control. Students with acute asthma will have their asthma controlled, and then they have fewer or less frequent asthma flare-ups in the schools. Now, reduce school-associated school absenteeism due to asthma, and then improve students' academic performance and asthma-related deaths. So that is why the school nurse is there to help the students achieve this goal. Now, major stakeholders I report to. My direct supervisor is the Borough Nursing Director, BND, and then followed by the supervising medical doctor in the Office of School Health. The other stakeholders are senior supervisors, and then on my level, other supervisors I share views and concerns about asthma management with. Now, asthma class in the schools, like I said, the nurse teaches students, asthmatic students, what asthma is, presenting signs and symptoms of asthma, how to control the asthma, and then you have to bring it to their level. That is why we have this kind of picture. Now, strategic plans. One of the things we must do to make sure we control asthma in the school is the daily presence of a registered nurse in the public schools. We have nurses in the public schools and in parochial schools on request. Now, the first step in the school is for the nurse to identify students with asthma and the diagnosis of asthma and history of asthma, and then with severity. You go according to the severity. Students with severe asthma are followed up first. Now the next step is issuing medication administration forms we call MAF to the students to take to their parents to go to their primary care doctors to have orders for medications to be administered in the school by the school nurse. Now, the next step is to case manage those students with asthma. This is done by the school health physicians and the nurses. These are the clinical staff. They have to case manage these students, follow them up, and as required. Now, the students with poorly or uncontrolled asthma, they are first placed on controller medications. For example, inhaled corticosteroids, example, Flovent, so as to, this is for prophylactic reasons, so that it will help to control the asthma and not make it flare up. Now, strategic plans continue. Now, in our management program in the school, another thing is to make sure students with asthma and exercise-induced asthma are placed on pre-exercise albuterol, so that before they go to any exercise, be it gym, be it dance, or any physical activity at all, they have to come to the nurse 15 minutes to 20 minutes and take their medication before they go to the exercise program. That way, their asthma will not act up during the exercise. Now, sometimes it is difficult to get the completed medication forms from the parents, so we ask for the help of the school administration, example, the social worker or guidance counselor, to help us reach out to those parents so that they can bring the completed medication forms from the doctors to the nurse, so that the nurse can implement the orders in the school. Now, the nurse will go further to teach the asthmatic students what we call open airways for schools. What this means is that the nurse will teach a 45-minute class once a week for 6 weeks to identify students with asthma, so that they will know what asthma is, the triggers, and then how to control the asthma, how to manage the asthma by themselves, so that they will be confident that, no, asthma cannot keep me away from exercise or keep me away from school. So that is what the nurse teaches in the Open Airways for Schools program. Now the reference, this is the reference page. So the students who have asthma are not left alone. We manage them in the schools, aiming to control the asthma so that they lead a productive life in the society and continue with their education, improve their attendance in the school, improve their academic performance, and then be responsible members of the society. Thank you.